It is Friday, July 22nd, 2023. Hi, I'm Tim, and this is my weekly update. Kind of late in the week, but thought I'd do it anyways. And figured I'd start with a small celebration. I am now done with the steroid eye drops, so there's only one left to take, which is awesome. Now, when the alarm goes off, I take one drop, I'm done, go, and I can go back about my life. Rather than having to wait 5 minutes, take another drop, and wait 5 more minutes, take another drop. It's just one and done. Uh, Now, just a quick recap of the week. On Monday, I took a unscheduled visit to my primary care provider and discussed the possibility of having hernias. Um, she agreed that it's a high likelihood, and I'm going to get scheduled for some sort of scan to just image the area, see exactly what's going on, and then possibly get referred over to a general surgeon to take care of those. While I was there, I also talked about getting back into therapy, and she gave me a referral to a therapist, um, kind of just to deal with stress and anxiety. Um, Stress is a major factor with ulcerative colitis, but I also noticed that it had a big role on the day of my surgery on the right eye. So I want to do the best I can to get a handle on my stress and anxiety levels and make sure that does not get in the way of a an effective surgery on my left eye. Um, so moving on to Tuesday, I have my second iron infusion appointment. Um, as usual, they did a good job at Bay Health taking care of me. Um, However, two main differences this time. There was a delay with the iron. I guess the pharmacy was a bit behind. There's a lot of patients in the oncology hematology area that will have iron infusions. I guess some of the chemotherapy patients have iron infusions prior to the chemotherapy cocktail um, to make sure that I guess their levels are up and they'll have the best possible outcomes. Um, for me, it's just the iron infusion, so I'm grateful for that. But yeah, they had a bit of a backlog, and I had to wait almost as long as the actual infusion to get the iron. So my first visit was about an hour. This one was more like 2 hours. Um, the only benefit to that was I was there around noon, and so rather than just a snack, I got a sandwich this time. So that was kind of cool. Um, as far as the results, I did still end up taking a nap later that evening, but the crash wasn't as bad as the after the first one. And I've still had low energy days. Today has been a low energy day, um, but I think the energy levels are slightly elevated over last week, and that I guess is normal. They give you a course of 5 or 6 iron infusions because it takes a while for it to, I guess, build up in your system. Let's see. So I think, it's slow, but I'm headed in a positive direction on that front. Then Wednesday, well, according to the original schedule, would have been my left eye surgery. And by now, I would have been all done with those surgeries and just in the recovery process. And even though logically I understand it's better that we're taking things one step at a time and gonna get the right eye lasered and inspected to make sure things are right before we move on. Um, it's still a disappointment. Uh, and it does hit a little bit that the journey got a bit longer. Um, so, not going to lie there. And, you know, next week on Monday, I've got my first therapy appointment. Hopefully that goes well, and I'm able to get a few things in place that I can work on to reduce stress and manage anxiety prior to my next surgery. Then Tuesday is the moment of truth on my right eye. That's when I'll go get the eye lasered and have it dilated so they can see exactly where the lens is sitting and make sure that it's in the right place and they don't have to go back in and readjust anything. So hopefully that all goes well. And of course, tomorrow's church. Hopefully I've got enough energy and I'm feeling well enough to go. I missed last week. And I think that was probably largely due to stress. And when I'm feeling stressed and anxious about something, namely the setbacks in the right eye, it can set me off and health-wise make life very difficult. So hopefully I manage that better this week and I'm able to get to church. I guess we had the funerals of two, older friends of the family this weekend that had passed away. And so there was kind of reunions from a lot of people that came into town to visit for those and stuff. I did not make either one of them, unfortunately. But I really look forward to having the energy and, just not having to second guess whether physically and health-wise I can go do things. Even things as sad as a funeral, but also the more fun and interesting things, the happier things as well. It's kind of a one step at a time thing. It's not good to have the possibility of another health problem with the hernias. But ultimately, I know that it's better to find out if I've got them and get them resolved than to just leave them lingering. All right, well, I think I've gone long enough today. I will check back in probably multiple times next week. I'm going to try and do one before I get the eye lasered and another one afterwards. We'll see how that goes. It all depends on energy and, if my mental game and my physical game line up enough times. All right, well, I will talk to you all later. I hope everyone else watching is doing well. I welcome any tips and suggestions. And, if you've got questions for me, what's working, what isn't, feel free to ask. You can leave a comment, direct message, or however else you'd like to get in touch. A lot of people have been talking to me in person as I see them at church or other places. So, all right. Have a great week. Later.